So throughout the day, we've been hearing about some wonderful population health initiatives. This next panel aims to provide a brief understanding of the current and emerging funding opportunities and highlight key areas of interest, funding opportunities, and strategic directions that can guide researchers in aligning their work, your work, with funders' goals. So our speaker virtually is Mr. Carlton Allen, who is a dedicated healthcare professional with a passion for advancing cancer prevention and research with a background in population health and health services research. Carlton has spent more than a decade making significant contributions to the field as a program manager for prevention at the Cancer Prevention and Research Institute of Texas. Carlton plays a pivotal role in coordinating, supporting, and evaluating program activities within the prevention research program. And most recently, Mr. Allen, he's led the charge for the updated Texas Cancer Plan. And so, Carlton, go ahead and take it away, and you can share your screen with us.
Sounds good, and hopefully you all can hear me.
Yes, we can.
Excellent. All right, and I hope you can see my screen now.
Yes, we can.
Perfect. Like what was mentioned, my name is Carlton Allen. I am the program manager of prevention at CPRIT. And so just want to thank you all for allowing me to come and speak with you today. At CPRIT and specifically our prevention program, we have a couple of goals and priorities. So we want to prevent and reduce the risk of cancer and make sure that we're detecting it early. We hope to fund programs and services to help those that are most in need, and then also build capacity to deliver prevention programs across Texas. So ultimately, we are here to reduce overall cancer incidence and mortality, to improve the lives of individuals who are living with cancer, and because of that, our oversight committee, which is CPRIT's governing body, kind of sets these priorities annually. And our requests for applications or our RFAs are based off of those priorities and our goals. And so CPRIT projects are focused on uninsured and underinsured populations. And there's a focus on rural and medically underserved areas. And so based on those priorities that are set by our OC, the prevention program is offering 3 mechanisms in the first cycle of 2026. These mechanisms include our primary prevention of cancer, or our PPC, our cancer screening and early detection, or our CSD, and our dissemination of CPRIT-funded cancer controlled initiatives or intervention, excuse me, so that's our DI program. And so, you know, when you all are looking through those RFAs, we just make sure that, and I'll probably say this a number of times, you read over those very, very carefully in the IFA, or the instructions for applications that come with the RFAs. It just helps for you all to get a better understanding of what we're asking for in our applications, what's required. And because those RFAs and the requirements within them do change from cycle to cycle slightly, but it's important to make sure that you're reading the latest RFAs for our funding. And so the RFAs can be found at our CPRITgrants.org, or they can be found on our website under Funding Opportunities tab. We have a current application cycle open right now. So that opened up March 19th, and that closes June 11th. If you are interested in applying, I would caution you to please not wait until the last minute to start that application and to submit that, just in case you come across any technical difficulties. We do have a help desk that's there to help support and available to answer any questions with our online application system. And then, of course, myself, I'm here to help with any programmatic questions that you all may have. And I'll make sure to provide my email address at the end of the presentation. All right, next. And so just some key dates for you all to be aware of. With this current cycle, you can see that, like I said, we're slightly in the middle of our current cycle with those applications due June 11th. We'll have our 2-tiered peer review over several months, so that happens in September and in October. And then for this first cycle, award notifications will be announced during our OC meeting on November 5th. And then for our second cycle, those are some tentative dates, but you can see we'll probably release the RFAs in August 2025. Our application system will open in September 2025 with applications due December, and then award notifications will go out during our May oversight committee in 2026. We typically have we run about 6 months apart, two cycles during the fiscal year. That is subject to change depending on the number of applications that we get, but we've been pretty consistent with having those 2 cycles. And so now I'm going to kind of talk about requirements of both our PPC and CSD RFA, and then I'll go into a little detail to talk about each individually. And so for both of these are delivery of services to rural and medically underserved areas. It's required in both of these applications. Oops, excuse me. Okay, there we go. And then we expect both, or for both of these applications, the source for evidence-based has to align with national guidelines. And in the application, it's important to make it clear which national guidelines you're following, and making sure that those are addressed throughout and in the references section. Collaboration is key, and so it's very hard to have a successful project working in a silo or a vacuum. And so our reviewers love to see those applications that are collaborating with other organizations or institutions, whether they're clinically based, such as FQHCs, or hospitals or clinics, community-based, so nonprofits and other groups and coalitions and others, to make sure that their project is successful. There are areas of emphasis that are listed in both the RFAs, but the project focus doesn't. If your project focus is not in one of those areas of emphasis, it's not that it doesn't mean you still can't apply. It's just areas that CPRIT right now is focusing on. And then lastly, remember, these are service delivery projects on the prevention side, and so they're based on evidence and not research projects. If you're interested in applying to one of our academic research projects, I would be happy to share that information with you all and get you in touch with their program manager. But they do have an individual investigator award for prevention and early detection. All right, so now on to our primary PPC application, and so, or PPC RFA, and so this one is focused on modifiable risk behaviors, and so we're expecting applications to be multi-level interventions, identifying with more than one level. So whether that's individual, group, organization, or community. A lot of times projects are addressing those non-medical drivers of health, or those social determinants of health, and integrating them within the project. And we do allow for our PPC projects to have complementary screening and diagnostic services. So, for example, if you have an HPV focused project and you want to include some cervical cancer screening services along with that, that is acceptable. If that is the case, then individuals or organizations and individuals would have to make sure that they're following the requirements of the cancer screening and early detection RFA if they're going to be doing screenings such as that. And now moving on to our CSD RFA. So these are projects that include engagement and outreach, public and professional education, delivery of clinical services, navigation throughout that process and into treatment. And as I mentioned before, collaboration is huge. So we want to make sure that you're working with partners across the state to be successful. With our CSD projects, there is a diagnostic and treatment goal with objectives that are already pre-populated in the system that are required to report on. Obviously, for these projects, we're focusing on rural and or medically underserved counties, and so one of those representations must be included into your project. And like I stated before, making sure that you are clearly stating the national guidelines that you're using, whether they're United States Preventive Service Task Force or other recommendations to make to include into your project. And then lastly, we have our DI RFA, and so this mechanism is focused on facilitating the sharing of successful CPRIT projects, CPRIT funded projects that want to kind of take what they've done, whether it's the whole project or products of the project, and disseminate that and implement that across Texas and in different populations, different geographical areas, things like that. New CPRIT projects, new PPC and CSD CPRIT projects cannot apply for a DI award. Those that currently have an expansion grant, or if you've had an expansion grant that was completed in the last 3 years, that's who we're expecting to apply under this mechanism. It is a smaller award, I believe, up to $450,000 for up to three years. But again, we don't expect necessarily for you all to disseminate the whole project. You can take out pieces of a successful project. And I'll go to the next slide. And then lastly, I'll just kind of tie all this into the Texas Cancer Plan really quick. And so if you're not familiar, the Texas Cancer Plan was updated December of 2024. And because CPRIT is charged with helping develop and assisting with or supporting the implementation of the plan, we also collaborated with many partners across the state, including the Cancer Alliance of Texas, or CAT, and those that are part of DSHS, such as the Cancer Registry and BCCS and the Cancer Control Program, to help update the plan. But it's a plan that requires partners across the state to understand and adapt their projects with those priorities and those that have the greatest burden of cancer across the state. And so, like I said, with the Texas Cancer Plan, the goals are broad, but they guide the plan's focus. It serves as sort of a framework to help unify efforts across the state. And within the plan, there's measurable goals and target objectives that the state hopes to achieve, along with strategies that key stakeholders and different stakeholder groups across sectors can look at to say, what can I do in my organization or within my community to help Texas meet our goals and meet our objectives. And so I know this may seem small, and I'll would encourage you to visit the plan and take a look at these yourself. But these are the 20 goals that are outlined in the Texas Cancer Plan, and you can see they're sort of broken down by primary prevention and risk reduction, screening, early detection, diagnostic and treatment, survivorship and supportive palliative care, infrastructure, and researching clinical trials. And then lastly, there's where the plan is. It's texascancerplan.org. And so, like I said, encourage you to visit, to look through it. It's all online and interactive. So feel free to play around with it a little bit. And here's my contact information. Thank you.
Thank you so much, Carl. If anybody has any questions, please just raise your hand and we'll get the mic to you. Carlton, first, let me just thank you for your leadership and that update of the cancer plan. I know that's a heavy lift, and it's I think just fantastic to have that plan available as sort of a beacon for implementation of cancer control efforts in the state. One of the questions that I'm often asked, because I've had both CPRIT research and CPRIT prevention grants, particularly for people who are doing prevention work, is how do I know when to submit it as a CPRIT prevention grant or as a research grant? And do you have any guidance or advice if someone is submitting to prevention?
Yeah, so I think the key there is if your research project or the work that you're working on, if you're submitting it and you have a control group and an intervention group, my suggestion would be to submit that under the academic research side. Our reviewers will see that and will think that it's research. On the prevention side, while you may have a project that is geared toward or focused on a certain population, on the prevention side, it's really, the services that you're providing are really for everyone, and so they're inclusive. If someone, even if you're focused on African Americans, if someone is Asian or Native American and they seek your services, then you're going to be serving them, which is slightly different than on the academic research side, where you can have a control group and you can have an intervention group that gets different services, or something that you're hopefully trying to eventually get towards evidence-based and making it more making it evidence-based so that you can maybe apply for a prevention grant in the future.
Thank you, Carlton. And I'll just also mention, just from the perspective of someone who's had CPRIT prevention grants, and also many of my colleagues also do. One of the fantastic parts about the prevention program is that it actually does pay for services. So that's very unusual in the types of grants that we usually get. And for the screening grants, it pays for screening and often follow-up as well. So thank you. That I think is the kind of program that allows for a lot of trust building in the community because they see a huge benefit. And then just on the topic that I asked about in terms of research, versus prevention, the prevention programs do require evaluation. So sometimes, it's sort of a fine line there, but if anybody is in that space where they're trying to decide, we've done a lot of these and we can maybe give you some advice if you're going one way or another. Any other questions? Okay, thank you so much. Thank you for joining us, Carlton.
Thank you all.
So our second speaker to talk about funding opportunities is Sarat Pratapchandran. Almost there. All right. I'm gonna continue to practice. Sarat is the Director of Development and Corporate Foundation Relations at UTHealth Houston, so one of our own. He is a skilled in proactive internal and external communications, content strategy, corporate social responsibility, journalism, and philanthropy. At UTHealth Houston, he works with faculty across all schools to match their funding ideas with corporations and foundations. Sarat transforms complex content into simple, easily digestible stories for multiple audiences, and he is eager to work with our faculty to discuss y'all's brilliant ideas and find funding opportunities for you for local, regional, and national corporations and foundations. So welcome, Sarat.
Well, thank you for having me. I truly appreciate this opportunity for development and public affairs. So I work as part of the development team here at the university. Kevin Foyle is our senior vice president, and I belong to a team within the team called Corporate and Foundation Relations. So Amanda Swift, whom many of you may know because she's been here longer than me, we work in that team. So let me start off with a snapshot of giving in this country. Philanthropy is a uniquely American concept. When you look at it, there are very few countries in the world which rely heavily on philanthropy. So in 2023, $557 billion came in through philanthropy. 67% of that came from individuals. Foundations gave 19%, corporations around 7%, and around 8% through bequests. So almost 26% came through corporations and foundations in that snapshot of giving. Now, the obvious question that you'll ask is, where did people give? So 24% gave to religion. So religion is the primary cause that people like to give money to. 14% gave to human services. Education is another 14%. Now, this data remains fairly consistent. It hasn't changed so much over the last 4 or 5 years in terms of where people are giving. So we got a good look at the context here about philanthropy in this country. Now, what role does philanthropy have in population health? Let me begin with saying that donors have unlimited opportunities. They can give to so many causes across Texas Medical Center. They can give to us, to other colleges. But the biggest thing is we need to diversify our funding resources. One area that they can fund is they can do seed funding for your projects. They can provide startup capital for new models of care. They could help you with purchasing equipment. They can definitely give to our mobile community clinics because as we speak, I know at least a foundation and an individual group, they're funding one of our mobile community clinics back in Rio Grande. They can fund prevention and early detection initiatives, help you find research for new cures. And the beauty of population health based on my limited experience is that you can show impact fast. You can show short-term and long-term impact faster than possibly other areas of research. So all this begins with your ideas, and your brilliant ideas is what we have to convey to funders. How will it transform lives? How will it improve population health? And what is your value proposition? How can you create change within a community? That's what funders want to know. Some want to see things happen during their lifetime. Some are willing to stretch it out for a longer period of time. So before you begin working with a foundation or a corporation or even an individual, I would advise you to start involving development early in the process, because we can help you tell your story with real clarity and passion. And your authenticity is what matters. We can align it with the donor's intent. And most often when I reach out to faculty, I ask them one simple question. And I'm asking the same question to you all. Can you, in one sentence, summarize your project idea? What will you do, where, with whom, when, and why? Because that's what the funder wants to know. That clear messaging of, this is what I'm doing, this is why I'm interested in this project. So that's very important. Now, what we do, fundraising, there are 5 stages of fundraising. Fundraising essentially is relationship management. All of us are fundraisers. So number 1 is we start with information. We gather information about who our prospective funder is, whether it's an individual, a corporation, or a foundation. We do a little bit of discovery. We kind of dig around and figure out more information. We try to get a meeting with them. Then as the relationship moves forward, we kind of cultivate the relationship. And then you reach that wonderful moment of making an ask, because by the time your relationship has strengthened, they're interested in the project, they're interested in the university. So we make the ask, they give the money comes to you. So what you need to do with the money is steward it really well so that they give you again. So that stewardship part is very important, because number 1, your projects need to be completed on time. Try to avoid no-cost extensions. Try to show the impact as you move along. So this is, almost all of us can do this. It's not a big science, as people say. It's essentially every one of us can kind of go through this cycle. Now, this is my 3rd public university that I'm working on, have been working on, and what I've heard on the street, and I can be very blunt with you. When you go to faculty, here's sometimes what I hear. I have no time to apply for private funding. I have enough federal funding. A $25,000 ask is not going to make any change for me. This will not help me in my professional goals. I dislike asking for money. I can't do another proposal. I don't have much help. Reporting is too much. I've heard it at Arizona State. I've heard it at the University of Houston. And so, across the public university system, unfortunately, this is what I've heard on the street, and this is what I've heard. So what we need to do is we need to go in and change that mindset, because the times have changed. As a disclaimer, and the truth is that philanthropy can never substitute for government funding. So the $557 billion that I told you earlier is very tiny compared to what states and what the federal government is giving out and supporting projects. Funding opportunities exist in population health. What you do really matters, because your brilliant ideas, the cures that you're coming forward with, the changes that you're making in population health, that definitely matters, and funders are always wanting to partner. The other thing is grants from large foundations add value to your portfolio. If you're an assistant professor looking for tenure track or something like that, having a Keck or a Templeton definitely adds value to your portfolio. Or if you're a professor and you want to kind of, show where you're going with certain kinds of research, these funders beyond the NIH and beyond the federal funding absolutely add value to your portfolio, whether you're looking for a job, whether you're trying to move for a promotion and all of that. And then the other aspect is when you get funding from the Walmart Foundation or, let's say, CVS Foundation, the publicity that they give you for your project, the reach of how it goes beyond a small NIH press release. I'm not saying that it's bad, but where it goes to a wider reach, and it adds again to your portfolio. The other important thing is all your pilot projects, even if they give you $25,000, at a particular point in time, they can be scaled. And as one speaker was talking earlier in the morning, that very few pilot projects get scaled. You leave it in the shelf, but that is another area where private funding can help. And then your long-term impact on community health, that is really valuable. So you can connect with me. Here's my email. All our development public affairs information is up on the website. But before I leave, I'll leave you with 4 takeaways, which I think, as aspiring prospective people looking for funding, the number one thing is please diversify your funding resources. The times have changed. If you are still going to rely on state and government funding, please diversify that. Be entrepreneurial, take risks, figure out ways. Say if a corporation comes and wants to partner with you, contact us. Let's help you navigate the issues within the system so that you can get funding for that. The second thing is stay focused for the short term, whether it's 3 years or the long term, both at the same time. Build a case for support because that's very important. And then lastly, contact development. I'm here to help you. So if anybody wants any help from our team, you can just contact us. Thank you.
Does anybody have any questions? I just have a quick question. So you said contact you. So if somebody has an idea, for example, about either a project, you were talking about projects, research projects, but also, do you think that there's funding for infrastructure? You've heard about several different centers here. We have institutes. Can you say a little bit about whether you think there's funding for that? And then what is the immediate process? Like someone contacts you and then what? Yeah.
So
Go ahead.
We have a simple form. I believe it's on the website, but if not, it's essentially giving us a gist of the idea of what we want to do. Essentially that one sentence that I was talking earlier. With regard to infrastructure, there are foundations that definitely give to capital, give to buildings, give to different areas. So if I put, one source that we use is Foundation Center. If I put the word population health in it, and I put Houston as the place where I want funding, 281 funders will come down. But out of the 281, how many are aligned to what we do? So that's essentially what we need to figure out. So absolutely, they give funding for equipment, they give funding for buildings, they give funding for everything. And if you are sitting in this building, this is philanthropy. So, thank you.
Thank you.
I had one quick question also. No, it's actually about hesitation to reach out to corporations and other interests. Just about the fear of conflict of interest, and what are some issues that come up that, if as a new investigator, if I would be hesitant, what would be some things that you would say, don't worry, or we will work with you on that? So I just wanted to ask you, if you have a general statement around something like that.
Just like any public university, we also have a lot of guidelines that we need to follow. But if the corporate funding, if a corporation comes to you and the corporation has a particular grant that you need to apply to, we are absolutely willing to help you. If the corporation comes and says, well, we want to give you a certain piece of equipment, absolutely, we can do that in-kind gift for you. We can work with you. Contact us. We will find a way to help you kind of align what you want with the corporation, but at the same time, adhere to our guidelines as a public university.
And thanks for that question, because that's something that I personally have struggled with throughout my career. And I've done a lot of work in HPV vaccination, for example, and had often been sort of contacted by Merck to be on their speakers bureau and other things, right? And I've actually not been involved in any industry funding purposefully because of the work that I've done for years in the community. I worried about the perception that that kind of collaboration would cause. And very recently, just over the last couple years, we started working with the Multiple Sclerosis Association of America, and they're a patient advocacy organization, and they had funding from Novartis. And the goal was to, or is to, establish a network, the Multiple Sclerosis Implementation Network of providers around the country to do implementation research. So this was just exactly what our Institute for Implementation Science, which you'll hear about in a minute from Serena, wants to do. It was perfect. But I had a lot of those concerns, right? One of the things that helped mitigate those concerns were certainly advice from the institution about the contract and how we set it up, and ensuring academic freedom, and ensuring that your publications, your work were not going to be influenced. So maintaining that academic freedom, but also, frankly, having that intermediary where they were getting funding from the industry partner, but they themselves are fully committed to, and their vision and goals are for patient advocacy. That also was really helpful. And so I think that there's an opportunity, one that I hadn't really thought about before, that in addition to considering industry funding, to work with these organizations. I think that there are many out there, and they're interested in population health efforts.